My name is Mohammad Meibar. I'm working as health program manager at Multi-Aid Programs, MAPS, which is a Lebanese NGO that was led by Syrian refugees. I'm working with Rebuild Project as a member of health committee at Majd al-Anjar municipality. I was one of two doctors who are Syrian in this municipality, and we are trying to do our best at this municipality to reflect the needs of Syrian refugees and to help the local communities to strengthen the local governance of the health system. My involvement with the Rebuild strengthen governance through being a member of Majd al-Anjar health committees and from my experience in the medical field and NGO as health program manager at MAPS, I have tried to promote accountability mechanisms, to promote transparency, to promote for strategic planning, not on the short term, and trying to get sustainability for the committee, not to be a short term committee. And I try to learn to help them with put clearer rules and structured planning for the committee and for its activities and projects. My work with Rebuild enabled locally driven health improvements through trying to promote evidence-based decision making and help the local communities and local community health community partners to identifying their priorities, their needs, and designing the activities that cover that needs and monitoring the outcomes of these activities. So the main issue is to bridging the gap between the community and the governments and reflect the real needs for the community through this evidence-based decision making and trying to improve the health section or health sector in the community through our committee. I plan to apply my experience with Rebuild in Syria by supporting establishment of such a committee that brings the health actors like professionals, health professionals, NGOs, local governance, and the Ministry of Public Health to join them to reflect the real needs of Syrian people and trying to improve the evidence-based decisions and to improve also accountability and strategic planning. And of course, the last one is to have a local owned health system that is really reflect the priorities and the needs of the Syrian people in their different regions.